Hey everyone, it's Medman. Today I want to tell you about a cancer breakthrough that might just be the beginning of the end for chemo, radiation, and even surgery, at least for some patients. Skipping the scalpel immunotherapy's game-changing moment. At Memorial Sloan Kettering Cancer Center, 2 recent trials gave us something incredible, a chance to treat certain early-stage cancers, and using only immunotherapy, no chemo, no radiation, no surgery. Instead of cutting out the tumor or blasting it with radiation, researchers used a checkpoint inhibitor drug called Jemperli, or Dostarlimab. It's a form of immunotherapy, and it worked. The key here is a mutation called MMRd, or mismatch repair deficiency. Cancers with this mutation accumulate tons of genetic errors. That makes them more visible to the immune system, in theory. But cancer cells are sneaky. They use checkpoint proteins as invisibility cloaks, telling immune cells, "Don't attack me." What Jemperli does is block that signal, essentially taking off the invisibility cloak. Here's the jaw-dropper: of the 49 patients with rectal cancer, every single one had a complete response. No evidence of cancer left, no surgery, no chemo, no radiation, just immunotherapy. And it didn't stop there. The other patients with colon, esophageal, stomach, and bladder cancers also saw massive benefits. Many had their tumours shrink completely. Others were able to delay or avoid destructive surgeries. One woman, previously told she'd need a permanent colostomy, went on to have a healthy baby after the trial. That's not just beating cancer, that's keeping your life intact. It's not just about killing the cancer, it's about how we do it. This isn't just a research headline anymore. Guidelines are shifting globally. Doctors are starting to use immunotherapy as a first-line treatment for eligible MMRd patients. The FDA has already granted Jemperli breakthrough designation. It's on the fast track, and so are we, toward a future where treatment doesn't come at the cost of our quality of life. I called this story "Skipping the Scalpel," not because surgery is obsolete, but because we're finally starting to ask better questions. Can we treat cancer smarter, gentler? And most importantly, can we help people live better after they survive? Survival is step 1. Living fully is the goal. If you found this as inspiring as I did, drop a like, share it, and subscribe. Let's keep pushing the frontier, one immune cell at a time.